Hey guys, welcome back to the channel today. Throwing a quick video together to talk more about child CPR. What does that actually look like? What classifies a child? And how do we give chest compressions to a child? So, with that said, we have our child mannequin here. Keep in mind when we're talking about children, we're discussing individuals that are between the age of 1 and puberty-ish, so usually around 12 years old, or the individual is less than 55 pounds. What we usually tell people when it comes to a child is think about any individual person who is in that daycare, preschool, kindergarten, maybe early elementary age group. That would be what classifies us as a child based on the age and weight breakdown that we have. And when we do CPR compressions on children, a couple differences that we have. Number one is the airway management. So in other words, how far do we actually tilt the head for the head tilt chin lift technique to give breath or ventilation? So remember, for the adult, we go past neutral. When it comes to a child, the language we use is slightly past neutral. So when we open the airway, it's slightly past that neutral position to maintain stability on the neck, head, neck, and spine, prevent injury, and also keep the airway open. The second thing is compressions. So remember, for a child, we compress at the depth of about 2 inches deep. So with that said, it's still okay to use 2 hands if you feel as though that's getting you about 2 inches. However, for smaller kids, it might be more appropriate to use a one-hand technique where we place the heel down with our fingers up right across the midline, across the anatomical nipple line of a child, squeeze the elbow in, have the shoulder over top of our hand, support the head in place with our offhand, and this is our body position as we're kneeling next to a child on the floor to give chest compressions. Again, 30 chest compressions, 2 rescue breaths, compressions going at the rate of 100 to 120 per minute, producing a high level of cardiac output. So again, squeeze the elbow in, lock the shoulder, shoulders over hands, support the head, push about 2 inches deep using the heel of your hand, allowing the chest to fully recoil between each of those compressions. So again, hopefully you guys enjoyed today's video talking about children and how do we provide adequate CPR care. Just a quick reminder, a lot of these situations with kids, especially infants and children, they actually are starting out or beginning as respiratory problems that can quickly transpire and lead to a cardiac emergency. So again, in other words, what that means is respiratory or breathing problems like choking, drowning, asthma, anaphylaxis, accidental opioid exposure, things along these lines that can typically cause breathing emergencies, persist over time, and can now turn into a cardiac emergency. Again, that's not to say cardiac problems don't happen with kids, they certainly do, but a lot of times it's usually respiratory that leads to cardiac. So hopefully you guys enjoyed today's video, learned a little something new. Make sure you like and subscribe for more content. Thanks so much.